whole healthcare industry is going to change dramatically in the next couple of years.
To chronic disease management and the preventative aspect of care.
AI can now understand the key clinical concepts of what's being verbalized in healthcare.
Welcome to Leaders in Healthcare. I'm Dr. Jordan Valrath, physician, entrepreneur, and chief medical officer for Cherry Health. We're talking about all things healthcare. Join us as we speak to innovators, industry leaders, and the people working to drive the healthcare system forward. Today we're talking to Abbas Zavar. He's a pioneering physician and digital health leader with over 2 decades of experience in medicine and health information technology. His career encompasses clinical practice, digital health consulting, and program management, showcasing his tech-savvy expertise and unwavering commitment to transforming healthcare. Abbas holds a doctorate of medicine, a master's in public health, and a master's in health informatics from the University of Toronto. His proficiency in clinical data sciences, augmented intelligence, and clinical decision support systems enriches his academic foundation. Abbas is a staunch advocate for the personalized medicine approach, which he defines as delivering the right clinical intervention, diagnosis, prevention, and treatment to the right individual at the right time. He champions this vision across his various roles in the community, including researcher, where he's leading several different research projects, leader, he's the digital health lead at Ontario MD, educator, he's working in multiple teaching roles across various universities, and advocate. He presents these concepts and the personalized medicine aspect at various conferences, symposiums, and events throughout the year. Zavar, thank you so much for joining us.
Hi, Dr. Valrath. Thanks for having me.
So I'm super excited for this one. This will be the second precision medicine conversation in the last few weeks here. So it's definitely a very interesting, evolving field. So thank you so much for taking the time to chat. This will be awesome.
My pleasure. I'm really interested to listen to the other podcasts that you mentioned too.
Definitely. Yes. Dr. Anmol Kapoor from a few weeks ago. That was a really good one. Well, so given your background both in medical practice and digital health, how do you see the two intertwining, especially with the integration of these fields in healthcare?
Yeah, it's a great point. So all the world is digitizing and healthcare is digitizing, but a little by delay and behind the other, I believe, sectors. But this is the envisioning the future, because right now we have lots of hot topic about AI, how AI enabled solution can be adopted and implemented in the healthcare professional health workflow. So the end point or ideal version of healthcare system and digital health in this intersection, I see it as personalized medicine approach. This amazing and comprehensive clinical model that using all characteristics of each individual, genotype and phenotypes, and as you mentioned it earlier, that describing it as providing the right clinical intervention, whether it is diagnosis, prevention, or treatment at the right time for the right individual. This is exactly that best patient-centric approach that we think about it and we expecting from ideal healthcare system.
And then let's back up a little bit. What is the difference between precision medicine and personalized medicine? Because I sort of thought the two were analogous to each other, but clearly there's a difference.
Yeah, to be honest, I couldn't find lots of clear distinguish between these two, because they are using interchangeably for this terminology. But by reviewing lots of related articles and publication, I realized that personalized medicine is more comprehensive because they are considering 5 main data domain. It's including, first one is healthcare or clinical data, everything about my hospital admission, my family doctor, my lab result, everything about pharmacy. So this is one domain. The other one is everything about lifestyle. We can explain it later in detail about my diet, activity, everything. Environmental, and recently mostly talking about social determinant of health should be considered as the other data domain. And the fifth one is biomarkers or omics, including genomics, proteomics, microbiomics. Based on what explained in different sources and references and my understanding, when you more focus on only genomics or omics concept of personalized medicine, that we can call it precision medicine. So this is my understanding based on all of these references. So I see personalized medicine is more comprehensive and covering lots of things. And precision medicine maybe more focused on just treatment, pharmacogenomics, treatment, something, but personalized medicine is more comprehensive and considering prevention and diagnosis as well.
And so until I'd read your paper recently, I actually hadn't considered, sort of the gigantic influence and potential in terms of data collection and how that would influence a person's healthcare going forward as we start to build these repositories for all these pieces. And so I thought this was actually one of the more fascinating things, was just like how broadly reaching this could be. So could you explain a little bit as to like the different omics, not just the genetics, but also like, you've got your micro gut biome, you've got your chemical exposure bio, what was the word for it? Fancy word for all the different things you could have been exposed to over your life. After reading this paper, it made me think of like, I just need some kind of sensor, this like omnipotent sensor to just wear around for my whole life, as it collected all these different, like how much UV light I've been exposed to, how much radon gas from the basement I've been exposed to. Maybe just explain a little bit more about like all these different facets of that personalized medicine that at some point hopefully will be captured with data.
Yeah, after I got involved with this amazing model, I believe 2 years ago, started on exploring Ontario as an example of platform if we want to proceed, implement, adopt a holistic personalized medicine by considering all those 5 main data domains. I have done a deep study. I interviewed almost 80 executive director and managers in different level of healthcare system, hospitals, primary care, research centers, policymakers, all of this, and see all what's happening for this. So we have lots of challenges still in healthcare system to capturing all clinical and health data. Most of them are siloed or less interoperability, lack of privacy and security, content or interoperability data standard. We are still challenging with all of those stuff. But regarding when we focusing on omics, right now, mostly genomics is most highlighted one. Proteomics or microbiomics, they are very a new study and new research topic. And it's almost 95% are siloed, no sharing. Genetic health, genetic research center, they are just kept this information, don't want to share with anybody else. So lack of interoperability definitely for genomics. For lifestyle, we need to capture we have mostly a smartwatch, a smartphone. We are automatically maybe capturing some of this information from our lifestyle, but accessing to that data is a big problem right now. Apple, Samsung, Google, they don't want to share easily this data with healthcare providers. For environmental, unfortunately, we don't have very personalized information, maybe by region, zone, your zip code or postal code. Maybe we have some information based on satellite information or the other receptors, but we can't personalize it for each person. And environmental is or occupational is very broad environment. We call it exposome. 3 type of exposome are around us: chemical, physical, or biological. And any of those receptors that capture any of those information, we can call it exposometer. And social determinant of health is the most challenging data domain if we want to capture that data.
Now, this has traditionally, I guess, been the role of the physician as they become one of the silos. They gather all this information about the social, about the lifestyle, about, did you just have an occupational exposure? Did you do the genetics test and find out some information? So this has been sort of like the manual process, very labor intensive, of trying to amalgamate all that data. How do you see that playing out as we go forward?
Right now, as we discussed, it's mostly our silo, and it's not really easy available or easy, how can I say, be able to analyze. For example, if a physician requests DNA sequencing, I believe you see the report, maybe it's coming from the lab. It's almost 200 pages. So how a physician can easily analyze all those pages and get that insight and connect the dots with other things? It's kind of impossible. And even, for personalized medicine, it's kind of very ideal clinical decision support system can receive all of this information, connect the dots, find patterns, find signs, symptoms, match with research publications, research guidelines, and providing some clinical insight at the point of care for physician to make a better decision. This is the whole idea. And we are not at that point right now because interoperability is the big challenge. And the other one is the biggest big data that this system should handle. Recently read somewhere that only for one domain, health data, whatever we created so far globally, not in Canada, it's almost 10 exabytes. Each exabyte is 1 billion gigabytes. So it's kind of a 10 with 19 zeros. So this is amount of the data that we just created for clinical data. Consider how much data we have for lifestyle, omics, environmental. Without AI, without machine learning, deep learning, we can't analyze this huge data, this biggest big data, and find pattern for this personalized medicine approach.
This show is brought to you by Cherry Health, Canada's medical network where healthcare practitioners connect. Physicians, pharmacists, nurses, chiropractors, and all other healthcare professionals can sign up for free, start connecting, messaging with colleagues, or checking out job opportunities posted by thousands of employers across Canada. With dozens of healthcare-specific job filters and search options, we make it easy to advance your career, find your dream job, or line up your next locum with hundreds of new jobs posted every week. www.cherry.health to get connected today. Well, I guess part of it is the capture of the data. And then, like you mentioned, the storage of the data. But there's still, I would imagine, a ton of work to be done across these different fields of, we're starting to get some connection between, your proteome or your genetics and how that influences how you metabolize certain drugs. But when it comes to the research of the impact of your exposome and your chemical exposures to how that affects your metabolism of drugs, or when it comes to all these second order connections, there's a ton of work that's still going to need to be done for probably hundreds of years, I'm assuming.
Yeah, we have lots of progress and achievement in this way, but we are not at the ideal point for now. But we have some amazing digital clinical decision support right now. For example, we have amazing one in Canada. They can identify signs and symptoms in the EMR system from all components and connect the dots and find the pattern for rare diseases. So they flag the patient for physician. This patient maybe is prone for these rare diseases. and what would be the next step. You should send to a specialist, request this testing or everything. So this is amazing.
This is the Cure platform. Is that the one you're thinking of? Yes.
Your health, exactly. And also, to be precise, is another amazing AI solution, digital health solution at US. They integrated the DNA sequencing and pharmacogenomics, recent pharmacogenomics data in one EMR system. And as a physician, when I want to prescribe a new medication for my patient, the EMR system analyzed DNA sequencing information matching with pharmacogenomics and recommend me if you want to, for example, want to prescribe any antidepressant, the first two option is contraindicated. The next two, you can use it by caution, but the last three is the best only for this patient. Another patient with the same age, same sex, same problem, but because they have different genomics, so recommendation would be different. This is amazing. So this is one only adding one component to one digital health solution. What if we have everything in one solution, and you can see how much AI that I love to, but augmented intelligence, not artificial intelligence, would be exactly augmented for all clinicians and physicians.
That is very, very cool how they've gone and integrated that. I can definitely see that as being a big business headache, like just trying to launch that platform of, okay, we got to integrate with the EMR. We got to convince the doctors to get the genetic testing, and then just how many people overlap within that Venn diagram there. But certainly, it's a great example of potential.
This is Mission Impossible, new episode. Tom Hanks want to do that.
Where do you see the most potential, I guess? Or what are you most excited for within this precision personalized medicine realm? The whole thing, or is there any parts of it specifically that you're more drawn to?
Well, definitely is a really big puzzle, very broad. But by more diving recently on AI stuff, because definitely for that model, the core would be AI and machine learning. So recently, based on my full-time job at Ontario MD, I got more familiar with all AI-enabled solutions, AI vendors. So I see the pieces, puzzle pieces, and I put together as the whole puzzle. I can see, for example, envisioning crafted a future version of clinical primary care workflow that the fully AI integrated pre-visit, end-visit, and after-visit. How for both users, physicians, and patients, how AI can support each of them in each stages. So by visioning that one and seeing the future, that puzzle, and looking for all those puzzle pieces, so we can create it hopefully in future. But to be honest, we are a little far away from that for now.
It's going to be a few more years.
Yes, we need more.
Well, it sounds like it starts with interoperability, or how do we catalog that data? How do you see that first step going? How do we actually start just building these data repositories in a useful fashion so that these various systems can start talking to each other?
Yeah, lots of steps has been done so far. For example, I'm not sure this is for provincial or national focus on patient summary. It's a very initiative in Ministry of Health, and also Ontario MD is involved on that one, to make a standard patient summary from all EMR systems. So in this way, all should be follow the same standard to create that patient summary, and all the time we can continuously update that summary after each visit. So this is the way that we should follow. More standard, same standard. And also in my white paper, I recommended that even not only a standard is one piece of that puzzle, we should see it as a big ecosystem. You know, right now, for example, we have lots of parallel activity. Just as example, AI Scribe is very hot topic right now, the most available AI-enabled solution for physician. But in my environmental scan, so far I have 50 identify AI Scribe in North America, mostly US. We have 10 to 15 in Canada. But I believe this is enough. We have lots of other lack of solution to, for example, for better interoperability or reduce physician burnout. For example, we have EMR inbox messy. So what if other AI developer focus on how you can prioritize clean EMR inbox, or all of this clinical decision support for each specific disease should be created. So then if we create that blueprint of that ecosystem to considering everything, and for each step, maybe we need a new policy making. We need to consider that one. Maybe we need a new privacy or security action. We need to consider that one. And not only in healthcare system, we need to consider everything out of healthcare system that affecting that. So we need that blueprint. Otherwise, we don't know where we are going. All this action is reactive, not proactive, and not aligned together.
Is such a unifying database, is that a realistic thing or more of a fantasy? Like, I'm just trying to picture the security implications of if there was one central system you could log onto and just all of this data was available. I mean, that seems like it would be a very, very big risk to have to mitigate.
Yeah, for sure. This is not my expertise about security, but definitely it would be a big concern about the privacy and security and all legal. But my understanding, if, for example, banking, they have very strong security system, or our government for some very sensitive information, they have amazing security system. So we can learn and apply that method to healthcare system as well. So this is my
it's true.
just an idea. Who knows?
It makes sense. I mean, people elsewhere in the world in other sectors are starting to figure these things out. I guess there's no reason we couldn't do the same here in healthcare.
Yeah, exactly.
AI seems to be kind of the core of the vision here. Like, when it comes down to it, there's just so much data, so many elements to consider. An average human is just very short stacked when it comes to comprehending all of it. I mean, even regular classical computing might struggle here. We're going to have to wait for IBM to come up with our quantum computers before we can fully take advantage of all the possibilities.
Yeah, but we had a very amazing growing in that sector, AI and machine learning, and all of those technology. ChatGPT, LLM techniques is amazing right now. It's solving some issue or problem issues or facilitate some challenging. Still, they are not perfect. We have some issues with them regarding the errors, bias, hallucination, all of things. But I believe we can pass over all of those stuff, and hopefully we can create it one by one.
So this is the direction we are going towards. What are you working on personally? Tell us more about the PAT, the preventative assessment tool.
Yeah, great. So back to my passion. So I'm working on personalized medicine approach from different perspective, and my personal research project is more focused on that. That white paper, it was the more environmental scan, what is happening, what are available, what are the gaps, issues, barriers, enabling. The thing that I'm really passionate about it is prevention. And unfortunately, this is the some of important thing missing or ignoring with most healthcare systems. So I just wanted to improve that approach. But in our EMR system, considering a primary care physician or family doctors, if they want to create a preventive prescription for each patient, they don't have enough information. For example, they don't have enough information about occupational risk factor, lifestyle, social determinant of health, mental health, or all of those is talking about personalized medicine. I see it from personalized medicine approach. So I started from a group of students from University of Toronto and George Brown College that I'm teaching to create a package of questionnaires. We call them PAT, or preventive assessment tools. Some valid, solid, reliable questionnaires that a physician can use, capture data from those data domains of personalized medicine approach to enrich EMR data. So we started to how we can design this project. And after I announced on my LinkedIn profile, amazing people, mostly with clinical background, IMGs, international medical graduates, or mostly newcomers, voluntarily joined to this project. And right now we are 45 people working on this project, all work as volunteer. And we group them for based on any of those topics I mentioned from 5 data domain, and we train them. There are systematic search to identify questionnaires and guidelines and publications to match all things. So this project will have 2 main outputs. One, a package of questionnaires that we can digitize them and physician, and we have that technology right away. All those required technology is available. We can digitize a questionnaire, physician or any admission staff or nurse in clinic, they can request it, patient completed and data sitting in EMR data enriching, and any AI platform, the same as we discussed at Pure Health, for example, then they can find risk factor for each questionnaire, make a pattern, and providing some suggest personalized preventive prescription. So this is one output package of questionnaire, and the other one, we created the map of all potential risk factors we can capture from those questionnaires with all potential disease and disorders. This knowledge that we will create would be the food for any AI platform to match risk factors with disease and disorders. Yeah, this is that amazing. We started last 2 months, and our progress is amazing. We are working together, and now I'm looking for any fund or grants or more support for make it this project sustainable, and also working with some organization on how we can create a new clinical model for implementing this approach in daily workflow without
That's super cool.
making burden on physician or patient.
Well, that's the big thing, right? All the doctors are already drowning and trying to keep their head above water with the amount of work, and such tools like you're describing would, sound invaluable, helping you distill through the mountains of information and research and turning it into something useful.
Yeah.
And where are things at then? So you guys are putting together the framework, I guess, the inputs and then the outputs for the clinical relevance to the patient. And then is the next step to, I guess, that you need funding to actually start assembling it into the actual code that would stand on top of the EMR?
Yes, exactly. Then we need EMR integration. As I said, the solutions and digital solutions are available in the market, but they need to adopt with this new approach. For example, any AI algorithm, they need to upgrade it based on this new knowledge we want to create. So even because all of these people working with me as a volunteer, and I don't want to miss them, but volunteer work need to be sustainable, be what I can, providing some incentive for the great job they are doing. We are more positive to create those outputs for this project.
Awesome. And how's it going in terms of just that assembling that initial, the first background layer of connecting that research to the clinical outputs?
Yes.
How do you even go about doing that? I would imagine there's just so much data and knowledge that you're trying to sift through and make it applicable or make it relevant.
Yeah, I agree. It would be huge data, but by using AI, we don't want to, as I said, make pressure on physician or patient. I envision all of this process, but for now, I focus on a step by step. For now, we want to create the collecting tool. But in future, for example, I know that patient, they don't like to complete lots of questions or questionnaires.
They drop off quickly if there's too many questionnaires, I've found.
But an intelligent chatbot that can conversation with patient easily ask some question based on that questionnaire, and patient answer it and done. You don't need it to understand what that questionnaire said or go and click it, yes, no, yes, no. Chatbot can manage it easily. And even if we are in future, this approach fully integrated with EMR, the AI will understand what kind of data is missing in patient profile, then send a specific questionnaire request for that patient, not the whole package. For example, if you have 20 questionnaires, maybe patient just need to complete 5 of them. The other information are available in the EMR system. So I see all of them by using different AI technologies, but let's start from the fundamental and create the collecting tool, and then we can design the other steps later.
Fascinating. And so how long have you been working on it for now? This has been going for a while.
Yeah, the idea, almost maybe a year I'm working on that one, searching, reading, and talking with experts and subject matter experts. But as a project, we started, I believe, early June to start hiring volunteer researchers, training them, and now they are in 17 teams. They are actively working on systematic search on databases.
Wow, amazing. It's a pretty hot topic for all the researchers. I imagine this is definitely getting a lot of attention and interest, from the, you mentioned a lot of the IMGs and the people just interested in medical research itself.
Yes, correct.
Very cool. Okay, well, what's next then? We're going to find a hook with MCI and the people with Cure here. They seem like they'd be interested.
Yeah, we are open, and I'm available for any collaboration, and for even, I believe this is that my understanding is that government should invest in this approach. Everybody knows that prevention is better than treatment. It's more cost effectiveness, but definitely it's required government focus and investment. I had a discussion with a couple of related organizations, and hopefully we can move forward. And even with some AI companies, but they are asking me, okay, what is the business case for this project? Who want to pay? Patient, physician, government, who want to pay? So, okay, it's a good question. I'm not a businessman. I'm a physician. I'm a scientist. But hopefully I can find the answer to them.
What started you on this trajectory in the first place? What was the personal draw or the connection to this, the AI and personalized medicine side of things versus traditional, evidence-based medicine and clinical care?
Yeah, it's back to my previous chapter before Canada. I'm a trained physician from Iran, so I work in a healthcare system for almost 12 years as a executive director, as a researcher, faculty, physician. But a healthcare system, the same, is related to government. And the same as other healthcare system, prevention is missing part. So I funded the first preventive medicine institute, private one in Iran, to start touching any of these preventive aspects. Because at that time, my specialty was focused on mental health and addiction. So I started working with UNODC, part of UN. They are focusing on drug and addiction. And we conducted the first preventive approach for Iranian youth to prevent addiction and drug use. And it was that time in my research and for that institute, I came with the personalized medicine model. And I said, okay, this is the ideal version. I should work on this one. But after I came to Canada, unfortunately, I couldn't manage that institute. But here I jumped in digital health environment by passing some degrees and master program. And I see myself in the right location that I can apply my clinical knowledge, apply in digital health, and follow my vision about personalized medicine.
Oh, I love it. I mean, that's one of the main critiques you hear of Western medicine is that we practice sick care and not health care. And so the preventative aspect is definitely acknowledged as being very overlooked.
Yeah.
It's interesting to hear that this is also the case in the critique in other parts of the world. I was starting to think that maybe it was just here we had this issue.
It's mostly all systems. We have limited fund for healthcare system, so acute care all the time is more priority for all healthcare system. So intentionally or not, they are missing or ignoring prevention.
Well, hopefully this gets us one more step in the right direction.
Yes, hopefully.
Very cool. Well, before we wrap up here, one final question. What is your number one personal health and wellness tip? What do you do yourself to keep the mind and the body healthy, feeling well?
Most of the time, I'm working on the desk, not really active job, active life. So I recently started exercising, going to gym, get the trainer. And to be honest, my life has been totally changed. I love this new life with more activity, and I recommend everyone, we need to consider this one. It's mandatory, kind of mandatory. It's behavioral change. Most of the time is challenging, but we have to follow. It's another prevention approach.
I fully agree with you. Yeah, when you're sitting there for your 14th straight hour in a row at your desk, the fact that you got your exercise done that morning at 5 a.m., it helps get you through those long days.
I agree.
Awesome. Well, Abbas, Zavar, thank you so much for joining us today. Really appreciate it. And thank you so much for taking the time.
Great. My pleasure. And thanks for having me.
Thank you for joining us this week on Leaders in Healthcare. If you enjoyed this episode, please like, subscribe, or leave a comment. And if you found this episode helpful, don't forget to share it with your network.